Everyone, welcome you all for today's session. Today is 31st session of students meeting, and I would like to start it with a quote that tells, "Wonder is the beginning of the wisdom." We all wonder how the dynamic particles work, and we all are screwed in the practicals for prescribing certain potency, right? And today we have amongst us doctor to talk about posology. And now I request Jamie to introduce today's speakers to us. Over to you, Jamie.
Well, good evening all. As Pearlie said, today we are in the 31st session of Conceptual Truthing Edge for homeopathic students. And today we are much blessed to have Dr. YASHIKA ma'am as our resource person. So ma'am have received her BHMS graduation from Nehru Homeopathic Medical College from Delhi University, and her post-graduation from DKNM Homeopathic Medical College, Maharashtra. Remarkably, Dr. is a STSET scholarship awardee by CCRH in the year 2015-16. So today we are so lucky to hear from ma'am on the topic posology, dose and potency. So ma'am, on behalf of entire IFPH team, I welcome you to this session, and on behalf of each of the people who have joined right now. And I also welcome all those who have joined here, and I also welcome our entire homeopathic doctors, students, and homeopathic lovers to this session. Over to
Thank you so much, both of you, for such a nice introduction. Thank you so much for welcoming me as well as inviting me as a speaker and giving me an opportunity to guide you all for this, guide you all on posology. That is one of the difficult topics, and when you come in, when you are understanding it as a student, you can. Though you can understand, but to remember and to practice and to clinically apply the law of doses and what dose you need to prescribe, how much repetition you need to do. So this all comes with experience as well as through teachings and understanding things deeply. So without wasting any more time, first of all, I would like to thank Dr. Shalu as well as IFPH for inviting me and giving me bringing me here to guide your students on this topic. And now I would like to start this session. I hope everybody is with us to learn on posology, though I have already taken a session previously on posology during the webinars which were going on in the past few months. But then so in this webinar, I've added some of the I've added a few important points that must be remembered as a student as well as a practitioner for this on this topic, that is posology. So let's start. I'll just share my screen and let me know if the screen is available. The screen is okay. Is my screen visible to you all?
Yes, ma'am.
Okay, great. So I think we can start with the topic, that is posology, dose and potency. So this is me, Dr. YASHIKA ARORA Malhotra, and I'm going to teach you what is actually posology, what is defined by posology, what are the types of doses, what are the sayings of different stalwarts on this topic, as well as how you can select the potency, how you can select the dose, how you can repeat the dose. So we'll be studying the same today in this session. I hope nobody will get bored. I'll try to wind it up in next half an hour to 45 minutes, though it is a vast topic, and clinically when you apply, it is difficult to apply. But yes, for the theoretical part and understanding things, we'll be going we'll be learning now. So let's start the session. When you talk about posology, the cure totally depends on posology. How? See, if you strike the hammer on the right way, on the right target, then only the cure will result. So one must be assured, one must be experienced enough, one must be perfect, one must try their level best to strike the hammer at the right point to get the cure. Dr. Stuart Laws has mentioned in practice the whole scale of potencies from the lowest to the highest is open to an homeopathic physician. So as a homeopath, you have the lowest potency from the mother tinctures, from the 6 potency, from the 2 to 30 to 200 to 1M to 50M to CM, and also LM potency. So we have so many, the whole scale of potencies starting from the lowest to the highest, which is open to us. But then it's the physician, it's the homeopathic physician who define his power and the sphere of influence over health as well as disease, largely by the number of different potencies he possesses and the skill which he uses them. So you should remember that which are the number of different potencies one must possess, and in which case you need to apply what potency, what is the skill you need to use. So I just want to inform everybody that this is my clinic timing going on. So if there is any disturbance for a minute or two, please excuse for the same. I'll inform if there is any issue in between. So one must remember this Stuart Law saying, selection of dose is as important as the selection of remedy. It is a very difficult toss, like knot. There is a knot when you what you say that knot we tie, गांठ जिसको कहते हैं, ऐसे करके गांठ जो बांध देते हैं. So there is a knot. This was termed, the potency was termed as a Gordian knot. Master Hahnemann has tried his level best and for his followers as well as the homeopaths to cut this knot. How you can open this knot by proposing how you can treat the all the cases with 30 potency. It was once a time when he was dealing with cases, so he tried his things with using single 30 potency to treat all the cases. So at that moment he termed potency as a Gordian knot. If the supposed seeker after truth is not willing to seek truth where it is found, namely in experience, then he may leave it undiscovered. He cannot find it in the multiplication tables. So if you are a seeker after truth and you want to search for the truth, namely in experience, then you must leave it undiscovered. You cannot find it in multiplication tables. This is said by Dr. Hahnemann. Now come the topic, that is posology. Posology is defined as the science, or you can say it as a doctrine, a law of dosage. It is taken from the Greek word that is posos and logos. Posos means how much, that is the quantity, and logos means the study. So before the beginning, I want to see the comments and I want to ask from the students itself that what are all the laws and what do you know about the dosage? I want to see the chats. I am waiting for replies that what all you know about posology. Nobody knows anything about posology. There are no comments. I think the people are getting bored and they're not listening. Susceptibility is important. Very good. Study of dosage. What are the laws which you discussed? What is actually posology? What has Master Hahnemann said? Dr. Rahul, you can just type in the chat box rather than speaking. We can discuss in the chat itself. I'm reading the chat. Great. Law of minimum dose, law of similar. So yes, these are few of the laws which we are going to discuss now. What is the standard measurement of dosage? What are the laws followed on the potencies? So let's start. The first law is the law of dosage. That is the curative dose. What does it? Law of dosage says the curative dose, the remedy, should be similar in quality and quantity to the dose of the morbific agent. That is the agent, the cause which is causing the disease. So the amount of vital force deranged, the level of vital force deranged should be equal, should be similar in the quality as well as the quantity what we are prescribing of the curative dose, the remedy. You must remember this, and those should be reduced to the smallest point. Everybody know we should follow minimum dose. We should give the smallest dose to the patient so that it results in the cure, rather than aggravating things or causing aggravation of symptoms, those slight aggravation. But that should be so much reduced that it should not cause much aggravation of symptoms. Law of dose, as said by Dr. Konstantin Herring, is having chosen the remedy according to the symptoms of a case from the complete correspondence of the characteristics in disease and drug. So what he is saying is, when you have chosen a remedy which is actually the same in characteristics as a symptom of the case you are dealing with, you should consider whether the symptoms of the case have more resemblance to the earlier symptoms of the drug. You should give in the lower potency. If there are more resemblance, if the symptom are actually matching, so to the later effects, the secondary effects, so you can even use higher potency in the drug in the case. So you got this point. When there are more resemblance to the earlier symptoms, to the primary symptoms of the drug, you should always use low potency. And if they have more resemblance to the later effects, to the secondary symptoms, so you can use higher potency as per Dr. Konstantin Herring. Dr. Ann Schulz has said that minimal doses of a drug stimulate. Everybody has learned this this definition, because in the first year itself we learned this in Organon. What is the definition of law of minimum dose by as mentioned by Dr. Schulz, and this is termed as Ann Schulz law. Minimum dose stimulate, they make things better. Medium doses suppress, they inhibit the action, and the large doses destroy the cellular activity. That means they create problems. So one must use minimal doses of a drug in order to cure the patient. You should think of the patient first, that you should give minimum to minimum medicine in order to cure him. So these are different laws, the 7 laws which are being followed in the posology. In the posology, there is some chat. We'll be discussing the queries in the end, like 30 to 100 moderate potency. We'll be discussing about all these things, don't worry. The different laws, in short, I would just tell you that law of dosage is already clear to you. The curative dose should be similar as the morphic agent. Law of quantity and dose, everybody should know this, that quantity should be always minimum in the inverse ratio. That is, the least quantity of the medicine must be given. When you talk about quality, so the quality should be always better. The action of the homeopathic remedy is always defined by its quality. That means if minimum dose with maximum benefit, maximum qualitative effect, you should remember the quantity law is the least possible medicine should be given. It should be infinitesimal dose, that is a very little dose, very slight dose, always minimum. When you talk about quality, this infinitesimal dose should be the best in quality in its inverse ratio. That means when it's minimum, that means the best effect. When you use this law of use, that is the dose and the quantity, it should go into the organism. It should be permeable to the organism. That means it should reach to the organism, and it should act on the vital force as well as make the functional sphere of the individual better. Law of repetition, if you talk about proving, so you should never repeat the dose when you are proving a case. When you if you talk about cure, which we'll be discussing in the further slides, that you should never repeat the remedy till the first remedy is acting. You should remember this. We learn about complementary relations. We learn about congenate remedies. We learn about many things, how to follow up the case, how to follow up the remedy. But the first and foremost thing you should remember is wait and watch. That is, Never repeat the remedy till the first remedy is acting. That is the first rule of second prescription as well as the repetition. So next we come to the types of doses. There are six types of doses which we will talk about. That is, the first is the physiological dose. That means that is the dose of the drug which is actually very much sufficient, that the quantity is also defined and the strength is also definite, and we give this dose of sufficient quantity and strength to produce some group of symptoms. Like if you give a physiological dose of belladonna, it will be producing dilatation of pupil, and then it may make your mucous membrane dry. Like when we are proving the drug, we get few symptoms of a remedy. Flushing may be seen in the face, and this is the quantity of medicine which could be administered with safety. So when you're giving a physiological dose, the quantity of the medicine should be given safely. Pathological dose is when there is a medicine, when there is a remedy which is capable enough to produce pathological changes, when it can harm the organism pathologically at the pathological level, like few biochemical changes, biophysical changes, and the suffering of an organism usually comes up with these different symptoms. They come up with the different symptoms, which is termed as a disease. So that is termed as pathogenic dose or a pathological dose. Like we give it to healthy persons while drug proving, and that produces a disease. So the next is the toxic dose. The toxic dose is which produces toxic effects on the organism. And next is the lethal dose that produces deleterious effect. That means so much lethal it is that it can lead to death. Toxic will cause some bad effects, toxic effects. When you talk about lethal dose, it can even lead to death. Dr. Stuart Laws has mentioned that minimum dose is a dose which is not capable of producing symptoms when used therapeutically. Minimum dose is always infinitesimal dose. So that dose which is capable enough to produce such symptoms that may be used as for a therapeutic purpose, for a medicinal purpose. That means only to cure the patient, not to aggravate or create problems with the patient, should be the actual dose. So one should remember this Arnschul's law, what has Stuart Laws said, what is law of dose, because when you are a student and things like these, if this comes in the exam, so you should remember all these notes. And when you're practicing as well as a practitioner, you should remember it, because these are only the guidelines which will guide you to the right prescription, to the right dosage, and you will use minimum dose to actually cure your patient. So all this posology, the study of these doses, it involves how to prepare this dose, how to apply this dose, how to give this dose, and what is actually the repetition. So everybody, when you talk about pharmacy point of view, the scales of repertorization, the scales of scales which preparation of medicines, like the decimal scale, the centesimal scale, the 50 millisimal, Korsakoff method, and Pinky's method, Skinner's method, Q potency. There are so many things which actually we read in the pharmacy level of point of view. That is pharmacoproxy, it is known as. So we are not focusing on this, but these are the things which must be grasped when you are dealing with cases. You should know about all these things. The second thing is how to apply this infinitesimal dose. You need to select the potency, you need to select the dose, you need to select the route of administration, whether you're giving it orally or locally or whatever, and what is the quality and what is the quantity of the medicine. Then comes repetition of dose, which is termed as pharmacopolaxy. So Master Hahnemann in aphorism number 247 has talked about repetition of medicine. If you have the books of Organon of Medicine, you can read it. The doses should be repeated at an interval of 14, 12, 10, 8 or 7 days in disease. But when you talk about acute diseases, they can be repeated in every 24, 12, 8 or 4 hours in the very acutest every hour. When the patient is dealing with fever and he is having high grade fever, you can even repeat the remedy in an hour. So the repetition differs in chronic as well as acute diseases. And in every case, it should be as per the course of the disease. The sixth edition, in the sixth edition, he has added the succeeding dose should be changed slight every time while potentized somewhat higher. When he gave about the renewed method, that is the method of 50 millisiemal he added, and he has given the renewed method of potentization in the sixth edition. He says that every succeeding dose, whatever dose you're giving, that should be changed slightly. That means it should be given in a higher potency. Like he has told about the 10 strokes every time we give when we are giving a 50 millisiemal potency. So for that, as well as when you're giving any medicine to him, so it should be slightly more potentized than the previous medicine, then it will act best. Now comes how to select the potency. There are few requisites which you must remember when you are dealing with potencies, and when you have been given a target to select a potency in a case. So you must be clear about susceptibility. You must be clear about remedy reaction. What is the action of the remedy? How will be the remedy reacting when you give it? What is actually the seat of the disease of the patient, whether is the disease is at the functional level, whether he has mild migraine, whether he has chronic migraine, or whether he has chronic COPD, it's a chronic COPD case, or whether it's just a mild cough. So you should always be clear about the seat of the disease, intensity of the disease, to which intensity it has affected, what is actually the duration of treatment you require, what the patient has already taken, and what actually you are going to take the time, and the previous treatment taken by the patient. You should always know about these things whenever you are selecting the potency. The first and foremost rule you should remember and memorize this: high the susceptibility, high the potency. Always remember, high the susceptibility, high the potency. High potency, whenever you are giving high potency, the high potency you should give to the young people, to the sensitive people, to people who have sanguine temperament, bloody people, full of blood, full of energy, intelligent people, zealous, very enthusiastic people, very excited, very enthusiastic, very intelligent, emotional at the same level, and who have functional pathology. When the patient's disease is at the functional level, only functional changes have been occurred. So you should remember this functional pathology. In the functional pathology case, you can give high potency. High vitality, when the patient is strong enough to his immune system is still strong, his vital force is still strong, that he can revert back well. And at every succession you can increase the potency whenever you not every succession, whenever the requirement is there, you can give the high potency than the previous remedy. When you're giving a more similar remedy than the previous one, you can increase the potency, or the mental picture is exactly the same as you are getting in a patient. The mental picture of the drug is actually the same. You can obviously go for high potency. That will give you wondrous results, I would say, beautiful results that would give you when you're getting actually the similar mental picture as the drug. And when you're dealing with crude drugs of violent nature, you can obviously give high potency. When you talk about low potency, so low potency must be given to old age people, to dull people, to children, to torpid constitution, to phlegmatic, full of fluid, very lethargic, very low in energy, very sluggish people, you should give low potency. Low potency must also be given in cases of advanced pathology, when there is cancer, when there is ulcer, then there are things which can cause more damage to the patient. The pathology is at a bad level. So you can obviously think about low potency. See, there are two ways. Some people think that in a patient of cancer, you can give carcinosin 1 m or you can give carcinosin 10 m, and that will cure the patient. While other practitioners may also get this result that giving low potencies in the cancer cases will act better, will give them longer life. Rather than giving high potency, it may also lead to the worsening of the case. So it depends on all your practice. As per my experience, I would suggest that in advanced pathology cases, you should always start with the low potency. That would obviously give you better results, better feedback, and long term of patient's life. When the patient's vital force is very low, immune system is very low, he's very much weak at the immune level. So you should always go for low potency. If there is a poor indicated remedy, when you're not sure if the remedy is right or not, it is a partially similar remedy, you should always go with low potency. So I hope everybody will remember this, that high potency should be given in such patients, and high potency can also be given in the acute cases when you are repeating the same remedy. In the cases of nosodes and tautopathic remedies, when you talk, you should give high potency. You should always give high potency in the cases of when you are dealing with cases when you are prescribing nosode or tautopathic remedies. While low potency should be always, the chronic diseases should begin as, or in the chronic cases you should deal with low potency. In the hypersensitive patients or the idiosyncratic patients who are very sensitive to few of the things, or when you are giving organopathic remedies or the rare lesser known remedies, should go for low potency. The sphere of action of the potency, how it acts, the medicines acts in 3 different planes, that is the outer plane, the middle plane, and the inner plane. So when you talk about the crude drug, the mother tincture form, so it acts about the on the outer plane of the person, outer plane of the individual. The low potency goes to the middle plane, and when you talk about the high potency, it goes to the inner plane, to the inner sphere of the individual. So you must be very much pretty sure that when you're prescribing a high potency, or whether giving a mother tincture or whether giving a low potency, to which level it would act. Because medicines can only affect the interior planes of the physical economy. When they are raised in the power, they'll go deep inside to the individual to act. So it will act curatively because it is so much potentized to the degree that man is sick. So because we potentize the remedies, they act at the vital force level and dynamic plane. So they'll result in the cure. Such as are sick in the middle plane are sick from that plane to the outermost. When, see the previous slide, when the patient is ill in the middle plane, it will be ill in the outer plane as well as the middle plane. When he is ill at the inner plane, it means all the 3 planes are affected. When he is affected on the outer plane, it means that the sick is only in the outer plane. So in high potency is always given to affect all the 3 planes, so that it results in the betterment of the patient. If the grade of the disease is low, the power of reaction is low, the remedy should always be given low. In conditions when there is termination, when the death can result, the patient is not reacting to the well-selected remedies or the intercurrent remedies or any remedy which you are prescribing, nosode, etc., in the potentized form, then you can go for a crude drug, which will obviously help out in such cases. In cases of outermost effects, when the patient is just affected at the outer plane, and the inner it has not reached the innermost degree, you can obviously temporarily remove those things by lower potencies and crude drugs. The advantages of high potency we'll read, and then when to administer which remedy. The high potencies show their best effect in a single dose. First is this advantage. You can only give a single dose, and that will obviously help out the patient. High potencies may at times show the slight homeopathic aggravation to you, that you will get a click that yes, my remedy was right and the patient will be cured now. When you see the slight homeopathic aggravation in a patient when you have given a high potency. High potencies which are being produced, like this is, they are talking about the 50 millisiemens potencies. The high potencies that are being produced by these strokes, 10 stroke we give, so they'll not cause any homeopathic aggravation. We all know that 50 millisiemens scale is one of the best discovery which Master Hahnemann gave us before dying, because it is one of the best potencies, best scales which will provide no homeopathic aggravation and will result in the cure of the patient. We can repeat the 50 millisiemens dose so many times in a day through the patient without giving him any aggravation, without creating any aggravating factor for him. So they'll not cause homeopathic aggravation, the 50 millisiemens. The higher potencies usually make the medicine more assimilar. They'll make it more homeopathically effective, because the higher the dynamization, they'll be giving good results when the lower potencies are not acting. So higher potency will give obviously result. You should always follow this rule in while you are giving a high potency, that more receptive the organism, more responsive the organism, more energetic the organism, more susceptible the organism, higher the potency and small is the dose. Always remember this. You can use higher the potency and smaller the dose. They act best in a single dose. When you're giving 200, when you're giving 1 m, when you're giving 10 m to a patient, try to give it to the smallest dose. When to administer the remedy now? So these are taken from many of our philosophy books only. This is compiled. So you should always give a antisoric remedy. When you're giving an antisoric remedy in the morning, you should ask him to take empty stomach. When you're giving nosodes, intercurrent or constitutional remedy, you should always give it when the acute episode or the acute exacerbation of the disease is over, and the patient is now again back to this chronic attack level, like chronic thing going on. The acute phase is over. You should always prescribe nosodes, intercurrent and constitutional remedy at that moment. When you talk about females, the curative remedy should always be given after the menstrual bleeding is over, like the 5th and the 6th day. She should be prescribed the curative remedy. And this is just a note, a clinical tip for you guys, that sulfur acts best empty stomach. I've not added Nux vomica here. Nux vomica acts best at night. Like I think Dr. Boric or Dr. Nash or somebody has mentioned a stalwart that Nux vomica acts best when it's given in the evening hours. When to repeat the remedy now? When you talk about when to repeat the remedy, Master Hahnemann in aphorism number 246 has quoted, every perceptibly progressive and strikingly increasing emoliration during treatment is a condition which, as long as it lasts, completely precludes every repetition of administration of any remedy whatsoever. I hope everybody get this point, that whenever till the moment you are seeing some progressive emoliration, till the moment it lasts, you should always wait and watch and not repeat the remedy. Repeat the dose only when the improvement ceases. When the improvement stops, you should repeat the dose. This is also termed by Dr. Stuart Laws. This is one of the most difficult things to learn. The most difficult thing is obviously to learn to wait. So as a physician, as a doctor, as well as a patient, whenever patient is coming to us, the first and foremost and the most difficult thing is how you can wait. The patient wants immediate relief. He's saying, I want immediate relief. I don't want to wait. I don't want. When you're dealing with the case, it is very difficult for you to wait. What you need is actually three things which you should need is the wisdom, the courage, and the patience. You should have these three qualities as a physician. As a student also, it will obviously help you out. In aphorism 245, Master Hahnemann has quoted that perceptible and continued progress of improvement, whether in an acute disease or a chronic disease, it is a condition which, as long as it lasts, will obviously counter-indicate the repetition of any medicine. You should not repeat the medicine till you are seeing the improvement, because the beneficial effect of the medicine, the first medicine you have given, the beneficial effect of that medicine will obviously be there till perfection, till it stops, till the improvement is not being completely done. Like the action of the remedy is not over. You should not repeat the remedy. You should not give a new dose, because that will hinder the process of recovery. That will disturb the process. Every new dose of the medicine will obviously disturb the process of recovery. So we are learning now when to repeat the remedy, when not to repeat the remedy. So you should not repeat the remedy when you are seeing the curative response in a patient, when you're seeing a slight homeopathic aggravation. Always remember a slight homeopathic aggravation, not much aggravation. If you see that there is a lot of aggravation in the patient, that means the remedy was wrong. If there is only a slight homeopathic aggravation, that means the remedy was right. Status quo, when the patient comes to a stationary position, when there is no improvement, nor the improvement comes, nor the deterioration is there. So at that moment, you should not repeat. When old symptoms are recurring, you should not repeat the remedy. When the chronic cases, in chronic cases, when you have given a single dose, you should not repeat the remedy. And you can repeat the remedy in acute cases when the repetition is required, because the patient is in acute phase of our disease and it should be relieved as soon as possible. The chronic cases, in the chronic diseases, you should repeat with succession. And symptoms will agree when symptoms still agree, when symptoms are they are present, and in such cases you can repeat the remedy. I would like to request people, if you have any queries till now, you can ask in the chat box. Any queries, or I should continue the session? Okay, so we'll continue the session, then I'll clarify the doubts. So dosage must be sufficient. What is actually the dosage should be there is the dosage must be sufficient enough to moist the tongue, to reach to the tongue, to reach to our sentient nerves, so that they can reach to the sentient nerves. What I've seen in my practice is when you give the dose below the tongue, that acts at the best level, because the patient won't be chewing it. It will be reaching towards nerves, sentient nerves, very fast when you give it below the tongue. This is just a clinical tip for you all. And it should be sufficient enough, the dosage should be sufficient enough to moist the tongue. If you're talking about the 30 size globule or 40 size, whatever number you're using. The adult, 3 to 5 pills are enough. When you talk about children, 2 pills are enough, and in infants, only 1 pill is enough. Dr. Stuart Laws has also mentioned about lower potencies. The lower potencies will not cure all the acute diseases, all the infants, or do all the aged patients. See, the contradictory point you should always remember, like we have read that low potency should be given in children, low potency should be given in aged people or acute diseases. But that doesn't mean that they'll always cure all the acute diseases, all the infants, all the aged persons, nor will the high potencies cure all form of diseases, all form of chronic cases. So you should remember this, that all potencies are required for the cure of diseases, and any potency may be given in any case. The scientific man, the physician, should always be ready to grasp, to discover to the logic of experience. He should always be ready to both the cases when as per the experience, as per his logic. This is being said by Dr. Stuart Laws. So in any case, you can go for any potency, but still these are the guidelines which are given by our masters that you should remember when you're dealing with cases. A well selected remedy may fail if the dose is not proper. So the dose need to be proper, because the well selected remedy will always act if the dose is given properly. So I hope everybody is clear with the potency things, and we can discuss with the query section. I have a chat, I think. Ma'am, can you please tell what do you mean by low potency and high potency? Example 30-200, we say moderate potency as we cannot classify. So this is again a controversial question, controversial question, which always is a query of many of the homeopaths. When I was a student, I also had this query, and we used to ask from our teachers. So see, when you talk about low potency, below 30 potency and the 30 potency, you can term it as a low potency. And when you are dealing with, when you are coming to the 200 potency, it is the medium potency. 30 to 100 both come in the medium, and 30 you can also consider as the lower potency. And when you talk about 1000, 10M, 50M, CM, all these are the higher potencies. I hope your doubt is clear. Dr. I think it's the term, the name is coming as Peerly. So I hope my your query is clear. We can also discuss more queries. We have. I think we have the host with us. Guys, are you there? So I've done my part. We can discuss the queries, and if there are any doubts, if I've missed anything. So I would like to request to all the attendees that if you want to ask any queries, we are free to ask. You're free to ask now.
Hello, Dr. Yashika. May I ask you a question if possible? Thank you for the session. Thank you for your lecture.
Thank you.
Really enjoyed. I'm an allopathic doctor and also homeopathic student. My question is that I'm now being followed by autoimmune atrophic gastritis, which is one step before cancer, and my pathology is deep, but my vital force is high. So if you were to see a patient like me, would you prefer to choose a low dose potency or a high dose potency?
I would personally start with the low potency, because it's like when you deal with a case, when you are dealing with such cases that have advanced pathology, so you cannot be assured enough that your remedy is absolutely right, because we try our level best to choose the best minimum, but then we are not God, we are not Master Hahnemann that we'll always be right. So
Yes.
It's like we should always begin with the low potency, so that we do not hamper the health of the patient. At least if the medicine is right, it will obviously show its action. Even the slightest action would give you a direction, would give you a thing that you can go for a high potency after this. So this is my answer.
Okay, thank you very much. I really enjoyed the lesson. Thank you for your efforts.
Thank you so much, ma'am.
Thank you.
Thank you.
Thank you.
Any other queries? I think we have in the chat. Do we have the host and the people who are introducing I'm sorry, I don't know the names. I got a call from Dr. Priya, Darshini, and
Good evening, ma'am.
good
My
evening.
name is Roy Thomas. I have a question.
Yeah.
Ma'am,
Tell
can we, especially in case of cancer, is high doses of sulfur, is it practical to be applied sulfur for cancer?
See, it depends on the pathology. When you're dealing with a case of cancer, that means the patient, when you relate it with the myasm, the patient is at a psychotic level or he has reached to the syphilitic level, because the pathology is not at the functional level. So first of all, when you're giving it as a constitutional remedy, sulfur or whatever remedy it is suiting to the case. So if you are repeating it, so you should not give it in a hypertensive. If you're giving it in a hypertensive, don't repeat it. But you should always relate when you're dealing with cases of cancer or high pathology cases, always related with the miasmatic predominance. What is actually the miasma? What is actually the stage of the patient? He is at a psychotic level. What is the pathology actually? You cannot just prescribe sulfur in a case of cancer without it being the simillimum, that too in a hypertensive. So you must always be sure what level of what stage is the is at the of the disease, and what is the miasm, because cancer is always overgrowth, and when it reaches to the destructive level it becomes syphilitic. That moment you will always need an anti-syphilitic or an antipsychotic remedy first, then you will be needing an antisoric remedy at last, so in order to cure the case. So I hope your doubt is clear. Still you have any query, you can ask.
Yes, ma'am, it's clear.
Ma'am, there's query in the chat box. It tells, can we get how is the dosage for mental diseases?
Yeah, so we already discussed about the mental diseases when I was telling you hypertension and low potency. When you are getting exact symptoms, mentals, in a patient of depression, or in a patient of an anxiety case, or anything OCD case, there are many mental cases which comes to us. So in such cases, though it is said that the hypertensive works best, but when you are getting exact right symptoms at mental level, which is matching to the remedy, and it is actually very much similar to the remedy, the mental symptoms which you are getting, so you should always go for hypertensive. If you are at a doubt, if you are at a confusion, if you think it is partially simillimum, or if you think you are not getting a clear picture of that mental disease, that is a one-sided disease, if you say, then you should go for low dose. So I hope your point is clear, Dr. John, that when you're getting a clear mental picture that is matching to the simillimum, no, not Dr. John, Dr. Priyadarshini. Yeah. So when you're getting a very clear picture, you can go for hypertension in mental cases. That will show you beautiful results. But when you are not getting a mental picture, that is a one-sided disease, and there are very slight symptoms and they're not matching exactly similar. So I think you should go for a low potency first. And then when you get the clear picture, the symptoms come out, more symptoms you are able to see, then you can go for the hypertension. Dr. John also has a question. How far a wrong potency spoils the case than just not curing the disease? What to be done? What to be done once we come to know that the remedy is simillimum and we went wrong with the potency? See, dear, when you talk about spoils the case, that's why I'm saying when you are not sure of the potency, when you're a beginner, so start with low potencies, because low potency, if it is the right remedy, it will show some or the other result. It will show a slight betterment, slight amelioration in one or the other thing, that will obviously direct you to the right potency. If you have not chosen the right potency, it won't spoil the case. If you have used a very high potency and that is not the simillimum of the patient, maybe patient will have aggravation, or he may show the symptoms of that remedy if he is idiosyncratic or sensitive. So it won't spoil the case, but yes, the disease picture would be masked by the disease picture would be masked by the remedy picture. So you should always, when you're not sure, go for a low potency. It won't cure, it won't spoil the case, but yes, if the remedy is right, it will direct you to go towards the high potency. If the remedy is wrong, it will obviously show no result, and then retake the case, re-repertorize the case, re-find out the simillimum, and go for the simillimum as per the presence, that situation of the case.
Thank you, ma'am. If anyone have any doubts, please feel free to ask them or put them in the chat box. Dr. Anand has raised his hand.
Hello, can you hear me?
Yes, sir, we
Yes.
can hear you.
Good evening, ma'am. It's a wonderful session.
Thank
You
you.
have right policy potency. Can you tell me about this?
Sorry, sir, which potency?
Right policy potency you have written when susceptibility part, when to give high potency, when to give low potency in that section.
Right potency or fluxion वगैरह you are saying?
नहीं वो right policy potency एक word use की थी आप, जहाँ पे कहाँ हाई पोटेंसी देना है, कहाँ लो पोटेंसी पे जो डिफरेंस तो चार्ट था वहां पर.
एक सेकेंड, I'll just check. सब मैंने क्यू पोटेंसी यूज किया था, हाई पोटेंसी, लो पोटेंसी. कॉर्सकॉफ पोटेंसी यूज किया था.
राइट पोलेसी एक वर्ड था ना, राइट पोलेसी पोटेंसी डिफरेंस में जब डिफरेंस दे रही थी आप, वो जहाँ पे कब कहाँ पे हाई पोटेंसी देना है, कहाँ पे लो पोटेंसी है, वो जो डिफरेंस था राइट साइड के लोअर में जो था वो वाला.
राइट प्लसिंग पोटेंसी क्या बोल रहे हैं आप सर?
हाँ ये.
I want to ask it from the audience. We have so many doctors and students here. They are always obviously reading these potencies and theoretical part. Anybody want to share about this plusing potency, plusing method? Anybody wants to share in the chat box? Then I'll clear, don't worry, I'll be clearing your doubt. What is plusing potency, Wright's plusing potency? It was given by Dr. Elizabeth Wright. That is why I wrote it there, Wright's plusing potency. So anybody who is very good at studies and very good at theoretical part, anybody would like to share? This is one of a common question which comes in 5 marks by many universities. Anybody wants to share? Anybody? It is a very easy. It's a very easy question. Nobody is there. किसी को नहीं आता. Okay, we won't be wasting time. I'll just tell you. Dr. Anand, the plusing potency this is the plusing method which was actually developed by Dr. Henneman only. And Dr. Wright has coined, Dr. Elizabeth Wright, jinke about him we study. We know that about the saying that a well taken case is half cured. He only coined the term plusing. She only coined the term plusing, and she has mentioned this in her one of the books which you may also go through. That the book's name is A Brief Study Course of Homeopathy. So one of her books is there, wherein she has described about this plusing method and coined this term. Dr. Hahnemann, when he gave this potency, he meant to say, it is also mentioned in one of the aphorism, I think, in the aphorisms 240s, 245 to 250 in between. There is one, this is being mentioned, that cure won't be taking place when we repeat the same dose. When we are repeating the same dose, the cure won't take place. But actually, when you are increasing the dose, succeeding the dose every time very slightly, very potentized, very somewhat higher, very little potentized, slightly higher, then the vital principles may be altered without difficulty by the very same medicine. If belladonna 200 is not curing the case, maybe the belladonna 1 mg can give the cure. So this technique was termed as plussing method, plussing technique by Dr. Elizabeth Wright, because gradually it was increasing the potency till one reaches to the that potency which will actually cure the individual, actually will be the precise potency that cure will take place, as mentioned by Dr. Hahnemann in Organon of Medicine. I hope your query is clear, sir.
Ma'am.
Yeah.
Ma'am, how can we find that it is a time to wait, or if it is a time to change the remedy?
How you can decide whether to wait and whether to change the remedy? See, I already told you that till you see a slight improvement, when the patient is coming to you after a week, he says he had improvement for 4 or 5 days, and then he has become to the same level. Or when he comes to you and he's saying that I am having improvement, so don't repeat the dose. Wait for 2 weeks more. Give him SL for 2 weeks more, and ask him to revert when he feels that he is not getting any improvement or he is at a stationary position. Okay. Otherwise, you can go for like when the patient comes to you and he's saying he's not getting improved, and 4 days only he got improvement, now back to the same level. You can go for for that repetition or a slightly higher potency. When you are at a clinical practice, you will be gaining this with experience, and obviously it will be very easy for you when to realize that when you have to repeat the remedy or wait and watch.
Thank you, ma'am.
Dr. Priyadarshini, I hope all the queries are clear and we can come to the end of this session. I would like to request the host to please come up, and I hope everybody's query is clear. We can come to the end of the session.
Thank you, ma'am. It was a wonderful session and by enlightening us with the knowledge of potency and telling that the true homeopathy practitioner should always follow according to the law of minimum dose as said by Hahnemann. Thank you, ma'am.
Thank you so much, dear. Thank you, IFPH, for giving me this platform to share my knowledge and guide the students and the practitioners on this topic. And I'm glad to be a part of IFPH, and I would love to take more webinars and to be in the team for long, because they are so genuine and good people in IFPH. Dr. Shaji is there, Dr. Shalu is there, many others, Dr. Amir. There are so many people whom I am in touch because of this association. So thank you so much. You were great. You're doing a great job. You guys are doing a great job. And I am glad to be a part of the same. Thank you.